Guys, what's going on? This is Dave Tilley. We are back talking about some just common issues in gymnastics, things that I see unfortunately happen in gymnastics all the time and hold people back, cause some injuries and or lacking performance. So today we're going to talk about a super basic shoulder screen that I think every gymnast should be running themselves through or have coaches running athletes through, just to make sure that we know that we're not having athletes cheat their flexibility with their lower back or through kind of using ligament laxity. So we're going to do this seated setup. I made a fake wall here. So we're going to have somebody grab a floor bar. There's 3 grips that you really want to check, right? So one is going to be an over grip, right? So the shoulders are slightly internally rotated. Back's gonna be flat against the wall, head's gonna be against the wall. Can you get your arms over your head, right? And just see what you got here, right? Most people are pretty good with that. So now what we're gonna do is like more of a front grind or a flipped over externally rotated grip. The reason we do this is because most athletes who have soft tissue stiffness underneath their arms, they'll cheat it like this, laxity wise in their ligaments, but when they flip their palms over, the stiffness shows up and they start to arch their back or rib flare, they stick their head out in handstands, and you have to manage the soft tissue. We'll talk about that in another video, but can you do the same thing? Can you go flat? Can you get your arms all the way overhead? Right? Heather's pretty good. A lot of athletes you'll see will come 2 inches off the wall, right? And they'll have a ton of problem getting back because of all of that stiffness. The last one we're gonna do is just a beam grip for hand over hand. So we're gonna go, whatever hand you do in front is gonna be on the edge of this up here. Slide your hands up, perfect, right? So whatever hand they throw back for beam, and this one will be close behind it, right? Same thing all the way overhead, because again, the more narrow your hands go, sometimes that soft tissue that's very stiff is gonna hold you back from going overhead. So we'll talk about some extensive strategies to work on some flexibility here, to make the ribs not flare out anymore, to keep the head down, right? But throw people through this screen very, very easy and see, can they do it? If they still get through this and they're having problems, make it more strict. Don't have them hold a parallel. Have them do it with their hands behind like this, or their hands like this, hand over hand. They'll be fine, right? It might be a little bit more hard for them to do, but you want to make sure you're checking this regularly, because sometimes as athletes train more, they get stiffer and stiffer and stiffer. They lose their flexibility in these areas. They can't get their arms over their head. They might arch their back, start to crunch their wrist and back handsprings, get some elbow pain. Okay, so definitely make sure you're checking it out. It will help you get a flatter handstand line.